Health and Human Services Secretary Robert F. Kennedy Jr. wants all Americans wearing wearable health devices. It's part of his effort to make America healthy again. And as CBN medical reporter Lori Johnson reports, there could be potential drawbacks.
Wearables are electronic devices that use sensors to collect real-time health data that can be transmitted to specific platforms so that you can analyze the information or share with your doctor. Studies show these wearables can help diagnose conditions while helping motivate people to adopt healthier lifestyles. That's why HHS Secretary Robert F. Kennedy Jr. is promoting their use.
My vision is that every American is wearing a wearable within 4 years.
They're already seen on wrists in the form of fitness trackers and smartwatches. People use them to measure movement, heart rate, help detect sleep apnea, and glucose monitors that measure blood sugar.
I've personally had friends who've utterly changed their lives just from wearing a glucose meter. And they've lost weight, they've lost their diabetes, diagnoses, and you see this happen again and again.
Doctors often recommend wearables such as ECGs that monitor cardiac activity.
There have been people whose lives have been saved because their wearable devices were able to detect over the course of 24 hours an abnormal heart rhythm. That then brought them to their healthcare provider, who took a deeper look and found out that, yes, there is an anomaly, a problem going on right now with the heart.
Tech companies continue to expand options, such as this one designed to prevent sudden infant death syndrome, or this necklace to help improve posture.
We're about to launch one of the biggest advertising campaigns in HHS history to encourage Americans to use wearables. It's a way of people can take control over their own health.
Yet, alongside the praise, privacy concerns exist.
The citizens that are wearing these health devices don't necessarily know what information is being shared and whom it's being shared with.
For example, health companies could potentially sell data of certain patients, leading insurance companies to potentially raise their rates. That's why customers should be careful.
I think transparency from the company that is managing that data is a critical point for the patient to feel comfortable and understand what is actually happening with it.
Another issue involves accessibility. Kennedy says his agency is working on ways to make glucose monitors more available.
It's $80 a month, and we're exploring ways of making sure that that those costs can be paid for.
So while studies show wearables can improve health metrics and even save lives, issues such as data sharing and affordability persist. Lori Johnson, CBN News.
Thank you, Lori. Gordon, do you wear any wearables?
I don't wear any wearables, and that's because I'm concerned about the privacy of it. Who's going to have that data? Where's that data going to go? At the same time, there are these devices available to the home, whether it's a heart monitor that can plug into your home and give you a pretty accurate readout. The cardiologists say they're actually pretty good. I mean, they want to hook you up to their own machines in their own offices to make sure. But if you're looking for warnings about palpitations or warnings about AFib, they're absolutely wonderful devices. Anything to do with sleep studies, sleep apnea, having one of those devices monitor is a lot cheaper than going through a sleep study. The blood pressure cuffs, those are not hooked up to the internet, but widely available now. And that will keep track of your blood pressure, all of which is part of preventative health. And as we age, we have to look after these things. Those glucose monitors are game changers for people. So a lot of wonderful benefit to it, but to mandate that every American should have it, no, the health privacy issues are tremendous to that. And could we see insurance companies taking that and charging different rates and all those kinds of things based on risk factors? The reality is they can do it now. But do you really want that volume of data going to somebody else, whether to a provider? And any provider, as we all know, can be hacked. So for privacy reasons, I don't wear them. But I love the convenience of having them available in